friends and colleagues. I'm Wong from Hong Kong, and it is my honor to be here for this wonderful conference, international conference on dermatology and cosmetology. And today I would like to share some of my research with you all about the clinical responses of subcutaneous abdominal fat and rectus abdominis muscle thickness following HIFA. And as a disclaimer, I have no benefits in associating with whatsoever any commercial brands and products, and the presentation content is purely based on the basic science and clinical experience, and the presentation is intended for professional exchange of ideas and sharing of knowledge. And all of the floor will be welcomed for any new input of the updates and point of views. As we all know that the slimming and sculpturing industry is very popular nowadays. It's actually accounting for a very large amount of commercial activity in the US, the Europe, Australia, you name it, and the increment growth is actually at a very rocket speed. For the weight management, a lot of people will only remember we have to reduce the fat. But apart from reducing the fat, the thickness of muscles is also very important, because for delineating an outline of the curvature of the body, it is not only determined by the thin enough fat layer, but also thick enough muscle component. Therefore, we need to train the muscle. And therefore, for the slimming industry, we have a lot of machines for using the cold energy and also the hot energy in order to melt down the fat to induce the fat lipolysis, and at the same time we need to train up the muscle. And one of the very common technology is the HIFA, and a balance between the low fat and high muscle content will give you a perfect body shape. Muscle is very important because it is the only effective fat burner of your body, and it determines the metabolisms. It determines the BMR. It will improve your glucose intolerance by reducing the insulin resistance, and also the better muscle condition will also have a better catecholamine-induced lipolysis to reduce the fat. So once you have exercised your muscle, you will also have the general and also the regional fat reduction. And moreover, the diet controls can also be combined with the muscle training. It is important because when you reduce the dietary content, like the intermittent fasting, ketogenic diet, the ketogenesis is actually preferentially first burn your protein, that is your muscle first before the fat. If you don't exercise your muscle, your body will make your body to have the muscle wasting first before you really burn the fat. And therefore, exercise is important. And as I mentioned, muscle defines the main contour, and that's why we need to train up the muscle. In order to train up the muscle, we need to have the concept supramaximal contractions, SMC, for the maximum effective recruitment of the muscle to be trained. That is the point. As muscle is so important, and that's why this time we are talking about how to train up the muscles by using the HIFA. From my current studies in the topic of the clinical response of subcutaneous abdominal fat and rectus abdominis muscle thickness following treatment with a HIFA device, it has quite positive result. The mechanism of it is the muscle is actually recruiting not efficiently in terms of muscle fibers when we are doing the usual exercise for our usual populations. And the efficiency is as low as 30 to 40%. And that's why when you are doing exercise, you are actually training only 30 to 40% of your muscles. and that's why it is never be efficient, and that's why you will take a long time for the muscle to have the improvement and also improve the efficiency. Therefore, it is what we said, you have spent your full effort, but you've got only half of the effect. For the new concept is that we can actually rectify this situation by passively activating the muscle by induced potential. And this is what we call the supramaximal contraction of the muscles. And nearly 100% of recruitment of the muscle fiber passively in this way will be done. And the quantity of the muscle being induced to contract the maximum contractions will lead to more effective muscle growth and training. And data are actually available for Caucasians and animal subjects for a training of 30 minutes. But there is no Asian status, and we also think that for longer durations of treatment each time, up to 60 minutes, will be more efficient. With all of these ideas and data, they inspire us of doing our current research. We have recruited 13 participants with the mean age of 37.4 years old with a normal BMI, 22.5 kg per meter square, with both female and male. The inclusion criteria is the BMI less than 27.5, which is a normal BMI, and the average abdominal fat thickness should be within 3 cm. The average rectus abdominis should be within 2 cm. To have a uniformity of the fat thickness and the muscle fitness for all of them. The age is anyone falling in the range of 25 to 55 years. We will exclude the patients who has previous abdominal surgery for the sake of safety and other aesthetic procedure in the abdominal area. Use of the medications that affect fat and muscle composition and metabolism is also excluded. The metal implants, including the surgery, the prosthesis, and also IUCD, the intrauterine contraceptive device, will also be excluded because the high firm may induce currents in this kind of metal parts, resulting in the heat generation that causes burn of the internal organs. Of the patients are advised to maintain their daily activity, do not change their usual habit, and the basic biometric data were collected before the treatment. And we provide a total of 6 sessions of treatment for the patient using the high firm device. Schedules 1 to 2 times a week of treatment, at least 2 days intervals for a sessions of 60 minutes instead of 30 minutes of the previous studies, because we think that the 60 minutes treatment will have more prolonged effect in training up the muscles. And we apply the applicators onto the patients at the level of umbilicus with the energy of level up to 1.8 Tesla with the penetrations of depth run about 7 cm. And all of the patients are able to tolerate 100% intensity by the second treatment sessions. And then we measure the subcutaneous fat layers and the rectus abdominis thickness by the BMO ultrasound, the linear probe. And 6 positions of the fat layer and the muscle layer were measured with the maximum thickness of the second, third, and the fourth expansions of the rectus abdominis. Both sides were measured together with the overlying subcutaneous fat, and an average of these 6 points is calculated. We found that the fat layers is decreasing, the muscle is increasing in the thickness, and the patient has a high satisfaction rate. On the right-hand side of the table, you can see that for the fat thickness, the first table, there is a decrease of the fat thickness at the time immediately after completion of the treatment by 19.9%. And because of the metabolism is improving as the theory, we found that the fat layer is continuing to decrease at the first and the third months by 25.6% and 34% respectively. And the rectus abdominis thickness has increased by 0.29 cm, and the increment of the muscle thickness persisted at the first and the third month. And 92.3% of them are very satisfied with the result, and 7.7% of them strongly satisfied with the result. So the outcome is very positive. And we have used the 3D imaging for assessing the general appearance of the patient's abdomen. You can also see that for the A, B, and C, they are progressive improvement of the patient rectus abdominis and also decrease in subcutaneous fat. We can also appreciate the improvement of the outline and body contour. With the measurement, we can also see there is a very significant decrease in the circumferences of the abdomen compared with the previous existing result. The data shows the hyphen actually has the increase of the muscle layer by 20.56%. And the sizes is increased by 12.15%, which is similar to our data result. And the increase in the muscle thickness is around about 14% at 2 months, which is also similar to our data. And the effect is also similar to our data in the way that the increment of the muscle thickness is continued after the completion of the treatment. In regard of the subcutaneous fat, we have found that there is a decrement of the fat thickness by around about 20% at the immediate time after the treatment, and the decrement continues after the treatment at first month and third month by 25% and 34%, which is similar to other studies conducted by Cass et al. And also Kenny et al. So the implication of our results combined with the previous clinical findings, we conclude that this is an increase in the muscle thickness effectively by the hyphen, and together with the decrement in the fat thickness. And the effect will be continued for 3 months after the completion of the treatment. And we can also see that by comparisons of the different outcome, we updated 60 minutes of treatment, and the general outcome is better than 30 minutes. And the fat reduction is actually probably due to the catecholamine-induced lipolysis by the muscle achieved by the intense muscle activities and improved muscle conditions. And the supramaximal muscle contractions will activate the muscle passively, will make the usual active trainings being more efficient. For the further development, we can actually adopt more combined energy. For example, in this way, we can combine the hyphen together with RF, which can actually achieve in 3 pillars of improvement. First, the hyphen will cause the training of the muscle, And because of the improvement of the muscle condition, there will be already burning of the fat. And secondly, the RF will increase the temperature of the skin, the subcutaneous fat, and the muscle. At the muscle layer, it will improve the circulations and together with the heat shock protein, and therefore the improvement of the muscle thickness will be better than giving the high firm alone. And at the fat layer, it will also cause the increment of the temperature to the point of right about 43 to 45 degrees Celsius. At this temperature, it will actually causes the apoptosis of the fats that cause further reduction of the fat. And last but not least, on the skin, if there is increment of the muscle, that will also result in the contraction of the collagens that will result in a tightening of the skin conditions and improvement of the general tightness of that region. And the probe shape is also important, and size is also important, because our contours, the body shapes are actually of different sizes and curvature. And for more effective contact and delivery of the energy, high firms and RF, we should have different sizes and curvature of the applicator in order to have the most efficient outcome. And for the combined RF and high firm, in other study, we can also found that there will be a further more effective reduction in the subcutaneous fat and building up of the muscle, and the patient's satisfaction rate is very high. And this is also confirmed not only by the ultrasound study, but also the more accurate MRI study. We have also conducted similar study and research in our center, and we found there is also some improvement for the preliminary data, similar to the previous two studies, with the decreasement of the fat by 40% and increase of the muscle thickness by 10%. And these are the data. We found that the progressive improvement of the muscle and decreasement of the fat in a series. And this is the result of the patient who have got the first training by the high firm alone, and then afterwards with the high firm with the RF together with the dual therapy. We can see that from the day 0, this is like a fat trunk. And then after the high firm treatment, we can see that the muscle conditions and contour have much improved. And there is a further improvement after imposing the combined high firm and RF. So as a conclusion of today's presentation, body shape management is significantly big and growing worldwide, and high firm is the new trend of the treatment. It trains up the muscle and also have a synergistic effect with the active muscle training. And moreover, because of the catecholamine-induced metabolism of the fat-free lipolysis, it will result in the subcutaneous fat reductions, both globally and regionally. And for our study, we further verify that the reviewed protocol will lead to a better result with a longer treatment duration of 60 minutes instead of 30 minutes. And there is also a further development inspirations that by using the combined energy treatment of using the high firm and RF, it yields positive results. And further research can look into the combination treatment to have more conclusion. Thank you very much. And last but not the least, we have published a guide to aesthetic medicines and cosmetic surgery by 41 experts worldwide of 13 different countries and areas, including the topics from the energy-based devices to injections, from the cosmetic surgeries to anesthesia and practice safety. If you would have any interest in this, it is also available at the Amazon. Moreover, if you do have any further questions and things would like to share with me, you can contact me through the email. Thank you very much.